This video will be on alcohol and breast cancer. For what this video will be covered with is discussing what breast cancer is, discussing what's in alcohol, relevant research regarding how alcohol affects the body, studies done assessing alcohol's effect on breast cancer, and final thoughts and concluding thoughts. What is breast cancer? Cancer is the development of abnormal cells that multiply uncontrollably and spread throughout the body. The abnormal cells take over the healthy organs, leading these organs to no longer function. Breast cancer is a type of cancer that develops in the cells of the breast tissue. Symptoms of breast cancer include a lump of the breast, bloody discharge from the nipple, changes in the shape or texture of the nipple or breast, thickening or swelling, irritation or dimpling, redness or flaky skin in the nipple area or the breast. And then here are some examples on the side showing what that could look like. Breast self-examination is a really important practice for individuals to monitor their breast health and detect any changes that may indicate abnormalities such as breast cancer. Detection of breast cancer at an early stage can significantly improve treatment outcomes and increase the chances of successful recovery. Performing self-exams help individuals become familiar with the normal look and feel of their breasts. This familiarity makes it easier to detect any changes. Does breast cancer affect men? Well, while breast cancer predominantly affects women, it's important to note that men can also develop this condition. In the United States, about 1 out of every 100 breast cancer diagnoses occurs in men. Moderate drinking is defined as 1 drink or less for women in a day and 2 drinks or less for men in a day. For 1 drink, it can equal to 12 ounces of regular beer, 5 ounces of wine, and 1.5 ounces 80 proof distilled spirits. Does alcohol consumption increase the risk for breast cancer? Alcoholic beverages contain ethanol, which is a chemical substance that's a known carcinogen. A carcinogen alters normal function of cells, leading to uncontrolled growth and division, which can result in cancer. There's about a 30 to 50% increased risk for breast cancer once you consume 15 to 30 grams per day of alcohol, which is about 1 to 2 drinks a day. And then it increases by 32% for individuals consuming 35 to 44 grams a day, which is about 3 to 4 drinks per day. And then it increases by 46% for those consuming more than 45 grams a day, which is more than 4 drinks per day. How does alcohol affect the body? Alcohol has been demonstrated to affect estrogen levels. Estrogen is a group of hormones that play a role in the development and regulation of the female reproductive system and secondary sexual characteristics. It's primarily produced in the ovaries in women. Estrogen has many important functions in the body, including regulation of the menstrual cycle, development of secondary sexual characteristics, bone health, and cardiovascular health. Continuing on with how alcohol affects the body. It affects estrogen levels, which leads to alterations in breast density, thus increasing the risk for breast cancer. Long exposure and high levels of estrogen has been linked to an increased risk of breast cancer. Mammographic density, which is a measure of epithelial and connective tissue in the breast. It serves as an intermediate marker for breast cancer risk associated with hormonal risk factors. Individuals with an increased density are 4 times more likely to develop the risk of breast cancer compared to those who are not exposed. So for the research question, it asks, does alcohol increase risk factors for breast cancer? For study number 1, it's about alcohol consumption and cancer, which is a cohort study of 226,162 participants aged 45 years and over. The central goal of this study was to aim to assess whether certain drinking patterns are associated with an increased or decreased risk of cancer. What was found in this study was the risk of developing cancers attributed to alcohol consumption increased by 10% for each additional 7 drinks per week. Individuals consuming more than 14 drinks per week faced a 4.4% higher absolute cumulative risk of cancer compared to those consuming 0 to less than 1 drinks per week. Specifically in men, the risk rose from 12.9% to 17.3%, and in women, it increased from 19.6% to 25%, extending up to the age of 85 years. For study 2, alcohol promotes invasion in triple-negative breast cancer cells. This study was an in vitro cell study. The central goal of the study was to aim to investigate the impact of alcohol on the migration and invasion capabilities of triple-negative breast cancer cells. What was found in this study was alcohol treatment increased the migration and invasion capabilities of the triple-negative breast cancer cells in vitro. Alcohol-induced activation of the p38, MAPK, and JNK signaling pathways enhanced migration and invasion of TNBC cells. Study 3 is about alcohol intake and mammographic density, which was a cross-sectional study, and in this study aims to contribute to how alcohol consumption influences breast tissue composition and breast cancer risk as assessed through mammographic density measurements. What was found in this study was individuals with higher alcohol intake had higher mammographic density measurements compared to those with lower or no alcohol intake. For the concluding statements, it's just to summarize what happened throughout the video, which was the takeaway: breast cancer is a type of cancer that starts in the cells of the breast. It occurs when abnormal cells in the breast tissue begin to grow and divide uncontrollably, forming a tumor. Overall, while breast cancer primarily affects women, men can also develop this disease, and it's essential for both men and women to be aware of the signs and symptoms of breast cancer and seek medical attention if any concerning changes are noticed. Alcohol has been demonstrated to affect estrogen levels, leading to alterations in breast density, thus increasing the risk for breast cancer. Throughout these studies, it's concluded that alcohol consumption is an important risk factor for breast cancer. Alcohol contributes to the aggressiveness of triple-negative breast cancer cells. Individuals with higher breast density face an elevated risk of developing breast cancer compared to those with lower breast density. Eliminating alcohol from your diet benefits the body in numerous ways. By abstaining from alcohol, individuals can decrease their exposure to this risk factor and potentially lower their overall risk of developing breast cancer.